Imagine being unable to speak loudly enough to be heard by others, or suffering a cough that lasts years, or being unable to swallow food or liquids. Whether caused by illness or injury, these symptoms affect millions medically, socially, and emotionally. The study and treatment of these conditions is a subspecialty of medicine called laryngology. Whether a patient complains of a lost voice, persistent cough, or difficulty swallowing, often it takes a laryngologist to get to the root of the problem.
A laryngologist is an ENT, or ears, nose, and throat doctor. We all do our training and do the ears, nose, and throat residency, but then a laryngologist spends extra time and extra training specifically learning the arts and the trade of dealing with the throat, disorders of voice, swallowing, and chronic coughing. Laryngologists are more effective at treating disorders of the throat, namely because we spend our entire careers treating these types of conditions. We have advanced diagnostic abilities that we can actually diagnose, see the problem, share that information with the patient, and then formulate a treatment regimen which really differs from the general ENT who really deals with all disorders of the ears, nose, sinuses, oral cavity, and throat.
Laryngologists use advanced diagnostic and treatment techniques to identify and resolve voice, swallow, airway reflux, chronic cough, and other throat disorders. Patients with the most complex cases are treated here at the Institute for Voice and Swallowing Disorders at Phelps Memorial Hospital Center. The first step is an accurate diagnosis.
We have two exams that we're very fortunate to have that we use. One is called a modified barium swallow, which is an objective exam that uses radiology procedures to examine in a moving format what is happening with the swallow mechanism. We also have an endoscopic exam that's called a feast. We use that to also look more directly at the structures when someone is swallowing, and we can then objectively evaluate what type of disorder the patient presents with and then customize a treatment plan for them.
For many people with voice disorders, especially professional singers, vocal exercises with voice therapists are prescribed.
Right, like you're practically singing, okay? But try to stay on the same pitch, okay? Okay.
Often, these therapists are professionally trained singers themselves.
The kind of patients we see are often professional voice users, so not just singers, but clergy, lawyers, teachers, anyone who's had a problem with the way their voice sounds or the way it feels. I recommend exercises that balance the system of voicing. You have the vibratory source, the vocal folds. You have the power supply, which is the air or the lungs. And you have all the resonating cavities above the vocal folds to make those beautiful pinging sounds. And so exercises, for example, if I'm addressing the vibratory source, there may be too much squeezing of the vocal folds. So I would have the patient speak in a breathy way and do phrases like over and under, so the vocal folds are mostly open and not closed. On the other hand, if there's not enough resonance in their voice, I may, and we talk about this, putting the voice in the mask, I will have them do exercises like nya, 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 so there is a sound that's very forward.
In some cases, therapy is not enough and medical or surgical intervention is required. Specialized techniques with microsurgery can be used in the operating room to treat nodules, polyps, cysts, or scar tissue on the vocal cords, while in the office, vocal cord injections can be used to treat vocal cord paralysis, and laser surgery can be used to treat vocal lesions. Topical anesthesia avoids the need for sedation.
Today's treatments of the throat are much different than those in the past. We have newer techniques that allow us to really only remove the abnormal tissue in an operating room setting. We've also been able to take a lot of those procedures from the operating room and move them to an office-based setting where a patient could be awake so that we have the audible feedback to hear the changes occurring as we're performing the procedures. This allows for minimal downtime for the patient. They're able to literally walk out and be driven home that day. There is no anesthesia side effects associated with having procedures performed. And this really allows for our ability to see the problem being fixed as it's unfolding.
Voice and swallowing disorders are treatable, but it takes proper diagnosis and treatment by experienced professionals to obtain the best results. The Institute for Voice and Swallowing Disorders at Phelps Memorial Hospital is the only comprehensive interdisciplinary center in the Hudson Valley providing advanced, minimally invasive therapies for people with voice disorders, swallowing disorders, and chronic cough.
The mission here at the Institute for Voice and Swallowing Disorders at Phelps Memorial Hospital Center is to provide an interdisciplinary approach to help patients with chronic disorders affecting the voice, swallowing ability, and other chronic diseases such as reflux that affects the throat and chronic coughing. It is really our team approach that is so unique, where we work so closely together with a speech pathologist and myself, a laryngologist, to really formulate that plan to help that patient with their problem.
The professionals at the Institute diagnose and treat a multitude of throat disorders, including hoarseness due to benign growths, cysts, polyps, nodules, vocal cord paralysis, vocal cord spasms, tumors, swallowing disorders, which often present as gagging, choking, or a feeling of a lump in the throat, chronic coughs, which can last for months or years.
Reflux is a really big problem in this country, and at least half of my patients with voice and swallowing problems, the reason is due to reflux disease. People have chronic throat clearing, trouble swallowing, changes in their voice, often feel like a lump in the throat sensation. These are all very common symptoms that are often misdiagnosed as allergy or sinus disease.
The Institute for Voice and Swallowing Disorders is staffed by a caring team of specialists, including laryngologists, swallowing therapists, and voice therapists who are professional singers. These dedicated professionals offer life-changing treatments to patients who have been dealing with their disorders, sometimes for years.
This is personally rewarding because it is not just about having someone not be hoarse anymore. It is a quality of life issue.
You saved my life. You have saved my life.
The life-changing events that you can watch when they walk out your office so happy enhances your life and makes being a speech pathologist so worthwhile.
Over the past decade of my career here, I have witnessed so many different wonderful transformations. I recall a singer who could no longer sing. She could no longer even read to her child at night. And after surgery and extensive therapy, she's now cutting her second album. I've had a patient who's been coughing for decades, who now is no longer coughing and is resuming a normal life. And many of my patients with swallow problems who have been resigned to having feeding tubes have now had their tubes removed and are now eating and living a normal life. I find it so personally rewarding to help these people.
For more information about the Institute for Voice and Swallowing Disorders, visit us online at phelpshospital.org.